Oral questions by members.
Member for Bulkley Valley Stikine.
Thank you, Mr. Speaker. I rise today to speak on an issue that's very concerning to me. It's government's responsibility to look after the most vulnerable in our communities, and it saddens me to have to bring this issue forward. Bulkley Lodge seniors are living in conditions described by a patient's family member as, quote, dangerous and unacceptable, end quote. An elderly resident was injured after a safety belt was not applied properly, with signs of physical abuse linked to rushed or unfamiliar staff. If seniors truly deserve dignity, compassion, and safety, why do these horrific conditions continue?
Minister of Health.
Thank you very much, Honourable Speaker, and thank you to the member for the question and for raising what clearly is a very serious concern, because of course we all want to see, we know that seniors deserve the very best care in those years of their lives, and knowing that that is a top priority of this government to ensure the highest of safety standards, being the first government to bring in legislated minimum care standards, for example, to continue to work to bolster the healthcare workforce in long-term care homes and facilities that are providing these services. Mr. Speaker, I want to assure the member that I am deeply committed to this work. I welcome her to bring forward circumstances directly to me through my office so that I can work with her to address these concerns. Thank you.
Member supplemental.
At the same facility, a nurse reported a resident was assaulted not once, but twice by staff. The family wasn't told for 48 hours despite management knowing the day it happened. On some shifts, there's one care aide and one nurse for 18 residents. Former staff say there's no proper orientation for nurses, missed breaks, and thin supervision, and those who speak up face retaliation. Will the minister order an urgent independent inspection today, guarantee whistleblower protections, and immediately set minimum safety standards at ratios at Bulkley Lodge? Staffing.
Minister.
Thank you, Honourable Speaker, and thank you again to the member for the question. And of course, no one should face any form of violence in any healthcare facility in this province. That's why this government continues to take steps to ensure minimum safety standards are in place and that they are met. Mr. Speaker, there is nothing more important than taking care of the most vulnerable members of our society and of seniors, the people who have built this very province. That's why this government has worked so diligently and taken so many actions to strengthen healthcare, to build long-term care facilities, to build up the workforce in these facilities, to ensure that people are there, that minimum hours of care are being kept. And of course, Mr. Speaker, we are going to continue this work because we know we have so much to make up for. Mr. Speaker, we're not going to stop.
Member for second supplemental.
That's interesting. The minister says they're clamping down on overtime and ending travel nurses, but Bulkley Lodge is already running on fumes. Staff are exhausted, families are stepping up to fill in the gaps, and residents are the ones paying the price. In rural BC, where there's no backup, cutting overtime isn't a solution, it's a sentence. How does this government expect seniors to receive safe, dignified care when they're taking away the very lifeline keeping these facilities running?
Hear, hear.
Minister.
Thank you, Honourable Speaker. And I want to start just by thanking the people who are working in these facilities, in these centres, for their dedication and for the exceptional care that they provide across BC. Now, the program that the member opposite is referring to is a program that was brought in as a temporary COVID-19 top-up during some very exceptional circumstances that we were facing during the pandemic to assist private providers. Mr. Speaker, we're 5 years out from that now. The program is winding down October 31st. There are some months that facilities will have to be able to make the transitions they need to, but I want to again underscore the fact that this is just one program that has been used to support providers during a really challenging time. We continue to take action. We continue to take action to strengthen long-term care by continuing to build new facilities, completing more long-term care beds across the province. With 36 completed and ongoing projects, we're continuing to grow the workforce, training more healthcare assistants, improving services so that seniors can stay at home longer before needing to transition into a care facility. This is the work that we're going to continue to do with our partners to ensure safe, dignified living circumstances and care for the people who helped build this province. Thank you, Mr. Speaker.
Member for Courtney Comox.
Nonsense. 900 care homes, care spaces in this province are at risk with the funding cuts. We have not changed the basic principle which we have started this program under, which is that we have chronic staffing shortages that are affecting rural British Columbians. Why is this government cutting off the only support keeping care homes open in rural British Columbia, Minister?
Minister of Health.
Thank you, Honourable Speaker. We are building long-term care beds in this province at a rate that hasn't been seen for years. Mr. Speaker, over 1,290 beds, complete with another 4,300 beds on the way. We're training more healthcare assistants, adding more than 2,400 healthcare assistants, training seats into the complement of training seats that are necessary to build up this workforce. Mr. Speaker, I know that the member is new to being on that side of the House. I know the member is new to this House, but let me remind the member.
Members come to order. Members will come to order now. Minister will continue.
Let me remind the member that when his colleagues were on this side of the House, they left 9 out of 10 care homes not meeting government standards. They ripped up contracts. What's shameful is they ripped up contracts.
Tried to close my hospital.
Minister will continue. Minister.
What's shameful, Mr. Speaker, is they passed laws that led to the layoff of 10,000 workers. They forced workers to work at multiple care facilities, leaving homes dangerously understaffed and having residents face serious risk of infection. They froze safer rental supplements for seniors. Mr. Speaker, this government takes a different approach, improving the safety of long-term care homes, adding staff, legislating minimum care standards, putting money back into seniors' pockets by increasing safer supplements. Mr. Speaker, we are not going to stop this work.
Member supplemental.
I don't need a long history lesson or more excuses and long answers. Will the minister commit right now to immediately pausing these cuts, or are you going to throw 900 seniors out of their homes and into overcrowded hospital hallways?
Minister.
Mr. Speaker, what I'm going to commit to is the plan that we are already on, building more long-term care beds, expanding existing long-term care facilities, supporting staff recruitment and training, working closely with health authorities, with nonprofit providers, with our allied health providers, and ensuring that seniors get the care they need, providing supports at home, Mr. Speaker, to keep seniors safe. Mr. Speaker, nothing could be more important than this work. I am open to working with the member opposite. I hope that we'll be able to come to some constructive dialogue and do this work together, because that's what seniors deserve.
Leader of the third party.
Thank you, Mr. Speaker. It's good to be back in the People's House. Mr. Speaker, what a gift. What a gift Alberta's Premier is giving this government. They get to stand up for our precious northern coastline, prevaricating on an imaginary bitumen pipeline project. It's a perfect distraction from the very real work underway, the massive offshoring of our public resources in the form of liquefied fossil gas to enrich American billionaires. Meanwhile, gas flaring at LNG Canada is poisoning the air in Kitimat. It's only just begun, yet Northern Health has already documented asthma rates 74% higher than the provincial average, not to mention risks of lung and heart disease, cancer, preterm birth, and low birth weight that come from living in the LNG sacrifice zones. My question is for the Minister of Energy and Climate Solutions. Is he unaware of the health risks to British Columbians, or is pressure from industry lobbyists and foreign billionaires just that much more important to this government?
Minister of Energy and Climate Solutions.
First of all, I'd say to the member that the Cedar LNG project, for example, the Ksi Lisims LNG projects, for example, are led by First Nations. And it's okay for the member to be opposed to those things or to criticize those things. It's not okay, it seems to me, to consistently efface the role of First Nations, which is significant in those projects, which is consistently happening. So I just encourage him. It's absolutely okay for him to express his view on the project. As he will know, LNG projects in BC are significantly reviewed independently by the Environmental Assessment Office in BC that address these very questions extensively. These issues are extensively dealt with and continue to be dealt with. There are conditions on each of the licenses during the construction period and thereafter to ensure the protection of communities and support for human health. I think that that continues to be the case in BC. We have, as the member will know, the lowest emission LNG projects in the world. And we have, I think, some of the most comprehensive and significant reviews to address those projects. That will continue to be the approach of the government. And it's proved to be successful in attracting resources and capital to those projects, continues to be successful to make BC distinctive, Honourable Speaker, in the world for having the development of a new industry and the highest standards related to that industry.
Member supplemental.
Thank you, Mr. Speaker. I'm happy to debate the true ownership of these projects on another day. We keep hearing that the government cupboard is bare, so it's baffling that the minister justifies billion-dollar corporate welfare in exchange for a handful of jobs and a crippling burden on our teetering healthcare system from fossil fuel pollution. This government is making decisions based on old information or no information at all. The BC Energy Regulator is not effectively tracking emissions from gas flaring. Environmental assessments and industrial carbon pricing give companies a pass on emissions and air quality impacts during the startup phase, which, as we've seen in Kitimat, can go on for months. Again, for the Minister of Energy and Climate Solutions, we need a comprehensive, cumulative, and independent impact assessment and cost-benefit analysis of fracking and LNG export. Will the government fund it?
Minister.
What the member suggests is not the case. Kitimat has an extensive network of air quality monitors for fine particulate matter, nitrogen dioxide, sulfur dioxide, and other air contaminants, and the data is publicly available. So I think that to suggest that that's not the case, or that the extensive reviews done of LNG projects under environmental assessment haven't taken place on environmental issues is not the case. We continue, yes, and the member may say that 50,000 Canadians who worked on the first phase of LNG 1 is not a lot of jobs. Well, it's 50,000 jobs, and having met many of those workers, I can tell you that they feel very strongly about it. At the same time, people in the North Coast, nobody more than people in the North Coast, nobody more than the Haisla Nation, nobody more than the Nisga'a Nation are concerned about the environment in the North Coast. And so I think that I believe that strong environmental assessment, a process that really supports jobs in British Columbia and drives forward jobs in British Columbia is the right approach, and the evidence for that is the success of these projects and their low emissions relative to any similar projects in the world.
House Leader of the Fourth Party.
Thank you, Mr. Speaker. We have the highest debt in BC's history. This Premier has run up the highest deficit in BC's history. And now he's obstructing the most productive industry in the country, oil. Young people are fleeing to Alberta, including my own son, where there are more jobs, better pay, and cheaper housing. My question to the Premier is this: will he apologize to the mothers of British Columbians for chasing our sons out of this province?
Minister of Energy and Climate Solutions.
Well, first of all, having visited LNG projects in different parts of BC, having visited renewable projects in different parts of BC, I can tell the member that its sons and daughters, Honourable Speaker, and everyone else who works on those projects. And so I just object fundamentally to the suggestion by the member. The province of British Columbia is driving the Canadian economy with dozens of projects, not projects that are communications exercises, not projects that are communications exercises, without proponents, with a large communication staff, but without proponents, without business plans, without routes, without projects. Honourable Speaker, we're supporting projects across British Columbia, renewable projects, which the member opposes, Honourable Speaker. The North Coast Transmission Line, which the member opposes, Honourable Speaker. LNG projects across BC, we are leading a new industry with the lowest emission LNG in the world. So in short, Honourable Speaker, what we're concerned is driving the Canadian economy with real projects. And yes, protecting our economy and protecting our coast and standing up for British Columbians as we always will.
Member supplemental?
Yeah, more like driving it into the ground. Numbers don't lie. 25,000 young people left BC for Alberta last year alone. In Alberta, taxes are lower, the jobs pay better, people can afford housing. What a concept. And projects actually get built. Alberta Premier Danielle Smith knows what she's doing and lets Albertans create their own prosperity. But here in BC, this socialist premier is busy blocking pipelines and taking away people's futures. Will the premier fight for BC's future by allowing Alberta's lead to be on the map?
Minister.
I'd be concerned with members who oppose projects in British Columbia but support fantasy projects from other provinces, Honourable Speaker. Here in British Columbia, we are, I think, leading Canada in the development of real projects. It's why, when the Prime Minister identified in the first list of major projects in Canada, 40% of them were in British Columbia. It's because of the work of the people of British Columbia, of the workers of British Columbia, of the government of British Columbia, and of all British Columbians, in fact, in driving economic development at an important time. We know our economy is facing headwinds as a result of really vicious and unprecedented actions from the United States. And as a result of that,
Members.
Honourable Speaker, everybody knows that. Everybody in our country knows that, whether it's Premier Ford or Premier Smith or our Premier. Here in British Columbia, we are leading on the question. And you see it in the projects we're putting forward, the dozens of projects we're putting forward. In February, we announced 18 priority projects in BC. All of those projects have advanced since that time because we are driving to ensure that people in British Columbia get the jobs they need and we build the economy that we need.
Member for Skeena.
In a stunning admission of failure last week, the Premier said, quote, "I was wrong on drug decriminalization and the effect that it would have. It wasn't the right policy." And that it became a permissive structure that caused really unhappy consequences, putting it lightly, end quote. If the Premier now admits that his government's flagship drug policy has failed, why are the same ideological architects still in charge of BC's addictions response?
Member for Public Safety and Solicitor General.
Thank you so much for the question, and thank you, Mr. Speaker. And I'm pleased to stand here to respond to my first question as BC's Minister of Public Safety. And I look forward to productive and meaningful conversations with members opposite about matters related to public safety. Now, the challenges that we're seeing on our streets here and across the country are very troubling. And let me be clear that public drug use in British Columbia is illegal. Where there is drug use in public, police have the power to seize drugs and move people along. You recall that we stood up this policy as a response to a public health emergency. We want people to be able to call 911 if they are overdosing. The opposition and the police supported this policy when it started. And when it did not work as intended, the Premier made changes to address the concerns that we heard. We are going to keep working with our police partners to ensure that we save lives
Thank you.
and keep our communities safe.
Member supplemental?
Yes, thank you. That wasn't a response to the question that I asked. I understand that this is the minister's first time getting up in question period. I can appreciate that, but that is not the question that I asked. And to be clear, it's not true. The police do not have the ability to do anything about open public drug use, and we're seeing the real-world consequences of that. They're not doing anything about it because there's nothing they can do. Their hands have been tied. After 8 years of failure on mental health and addictions, this Premier has zero credibility on this file. Now he has appointed Larry Campbell to yet another czar-like role, but again refuses to release the details of his contract or mandate. Will the Premier commit today to releasing not only the details of this contract, but also an unredacted version of any report that this contract produces, yes or no?
Minister of Housing and Municipal Affairs.
Thanks so much for the question, and proud to be standing here as Minister of Housing and Municipal Affairs. The Downtown East Side is a vibrant community which, as the member knows, has experienced incredible amounts of struggle and resiliency, and our work as a government, alongside residents in the community and organizations serving the community, is to create tangible improvements in the lives across that neighborhood.
Member. Minister will answer.
As a former Vancouver mayor and federally as a senator, Mr. Campbell brings significant experience to this role, helping to expand upon the work we've been doing as a government and to bring together 3 levels of government to create tangible results. The contract, as well as the dollar amounts connected to Mr. Campbell, have been released. That information is public. Mr. Campbell has made himself available to media and will continue to. His continued priority is working alongside community organizations, bringing together those voices and levels of government to create tangible results, because it is a continued priority of this government to address the needs of vulnerable communities, including those in the Downtown East Side, and that's the work that Mr. Campbell is going to help us continue to do.
Member for Langley Willowbrook.
Thank you, Mr. Speaker. CAR 67 mental health response team pairing police with nurses still isn't running in my riding, a year after this government promised it. Everyone's ready, the city and police, except this government. They failed to plan and failed to care. Can the minister commit today? Will my community get CAR 67, yes or no?
Minister of Public Safety and Solicitor General.
Thank you very much to the member for the question. And we have seen the CAR programs, the crisis mobile, the integrated crisis response teams help communities across BC. We're committed to providing communities with the resources and police with the resources to work together to address some of the challenges of our time. We'll certainly speak with the community to
Member, let her answer, please.
I'd be happy to speak to the member to talk about resources that may be available to support public safety, to support the most vulnerable in our communities.
Member for North Island.
When we ask this Minister of Health about ER closures, she always tells us that this government doesn't, and I quote, take them lightly. But what are people in the North supposed to think when there's been 231 closures in 9 months? What about Interior Health with 129 closures? What the minister is doing to address this crisis is not working. So can the minister guarantee that this Thanksgiving long weekend, no ER will be closed? Yes or no?
Minister of Health.
Thank you so much, Honourable Speaker. Thank you to the member for the question. I can guarantee that this government is going to continue to take every action possible to support health authorities, to fill staffing gaps at a time when we are experiencing shortages of physicians and nurses and other essential healthcare workers that help staff these emergency rooms across BC. Mr. Speaker, I think everyone in this House knows just how important it is to be able to rely on that emergency room and knowing it is there for you when you need it. That's why this government continues to take actions to recruit, to train, to retain more healthcare professionals here in BC. Mr. Speaker, our efforts are working. As I said yesterday, from January to August of this year, we are down 25% in the number of hours that emergency rooms have been closed in this province. But it's not just BC that's experiencing these challenges. Mr. Speaker, 38% of our emergency departments have experienced a closure, but that number is 70% in Manitoba, 66% in Nova Scotia, and 57% in Saskatchewan. That's why we're going to continue to take advantage and seize the opportunity of what's happening in the States to attract more healthcare workers here. Mr. Speaker, that's why we're building a new medical school to train doctors to work here in BC. Mr. Speaker, we're going to continue to do everything possible. We know just how important it is to have those emergency rooms here for people in communities big and small across this great province.
Member for Delta South.
Thank you, Mr. Speaker. Last night, members of Delta Council expressed their outrage at yet another closure of Delta Hospital's emergency department, the 4th time this year. This is completely unacceptable for a city of over 100,000 people. Mr. Speaker, Mayor Harvey was on Red FM this morning and said that healthcare in Delta is broken. When will this government stop making excuses, take responsibility, and assure Delta residents we will have no further ER closures, including this upcoming Thanksgiving weekend?
Minister of Health.
Thank you so much, Honourable Speaker. Thank you to the member for the question, and I'm glad that Delta City Council had an opportunity to canvass at their meeting yesterday the incredibly important topic of what's happening in their emergency room and be able to talk about steps and actions they can take, and I look forward to continuing that conversation with the Delta Mayor and Council. I know that building out primary care in the community is an important component of this so that people don't have to go to the emergency room if they don't need to, because that's the work that we're doing to increase access to primary care providers. Mr. Speaker, it's incredibly hard on everybody when these things happen, but we need to uplift and thank the staff that are doing everything they can to fill those gaps, to work overtime and spend the time providing the support and the care to people when they need it most. It is extremely unfortunate, of course, that Delta had an experience for the 4th time this year, and we know that other communities are seeing this issue too. We did not get into this problem overnight, and we are not going to solve it with a single silver bullet. We are not going to solve it overnight either. What we are going to do is stick to our plan of recruiting more physicians, of training more physicians, of ensuring that they know about the opportunities to work in incredible facilities and communities across this province. We're going to continue that work because people deserve the care when they need it.
Member for Surrey White Rock.
Thank you, Mr. Speaker. Mr. Speaker, let's be clear. The minister in previous answers, you used the word dignified, right? They talk about all the work that she's doing, the meetings that she's having, the commitment that she has. Any moral high ground that this minister, that this premier had on the health file left when they deprived a child of terminally ill medication and made her, her family, a community, and a province beg to get it back. Unacceptable. An absolute embarrassment. We come in today and we ask specific questions. Questions on Car 67. Yes or no? Questions on a seniors program that is ending on the 31st of this month. Yes or no? The Premier, can he answer those questions today? Car 67, yes or no? The seniors program that is ending on the 31st of this month, yes or no? The Thanksgiving weekend that we're going into, will we have ER closures, yes or no? Will the Premier get up and stand up for healthcare in this BC, or will he hide again and let his minister stick to her talking points?
Thank you, members. Thank you. Thank you, members. Minister will answer.
Thank you, Honourable Speaker. This government remains committed to building out and strengthening our universal public health care system here in British Columbia, not adopting a two-tier system that I know members of the opposition would do if they had the opportunity on this side of the House.
Members, the question period is over. We've concluded.
Mr. Speaker, this government has invested more in new hospitals and healthcare facilities than the previous government did. Building a hospital even in the Leader of the Opposition's riding that he refused to build. Having two ATCO trailers stuck together, thinking that that was a good way of delivering care to the people of Fort St. James. Mr. Speaker,
members,
we are building in Terrace, we are building in Fort St. James, we are building in Dawson Creek. We are going to continue this work because every community, every person in British Columbia deserves strong health care, and that is what this government is committed to.
the bell ends the question period.